So it was very humbling to come to the realization that these people who were most in need of care had the most difficulty getting it. We knew that we needed to do something for these folks, and that's what led us to the formation of REACH. Our concept was that no door is the wrong door. You come to us and you get care, no one gets turned away. My name is Carl Stobie. I'm a family doctor. I've practiced for 20 years in Beamsville, and since then I've done some medical leadership for McMaster, including creating the Niagara Regional Campus and being in charge of the family medicine residency training program in Niagara, and I became the founding medical director of REACH Niagara. It all started with a cup of coffee. Fran and I were both at crossroads in our careers, and we enjoyed working together, and we talked about what's next.
What drew me to REACH was really the collaboration between many of the agencies in the area, and REACH just brings them all together. It makes those transitions for clients as we try to make referrals in this really difficult healthcare system a whole lot easier. It's just such a breath of fresh air. I'm Dr. Kim Bender. I've been working as a family physician for the last 25 years. I've worked in lots of different settings. So I had a practice for almost 20 years. I worked in the hospital system. I've worked in rehab. I've worked in long-term care as medical administrator as well. And I'm the new medical director for REACH.
Right, from day one we listened. We listened to the stories of homeless people's access to health care through projects done by medical students. We listened to other organizations that were involved with homeless people, as well as other communities. We were able to discover a list of barriers to homeless people accessing health care in Niagara, and our big question was, what can we do to help?
Working as a family physician in the healthcare system today is incredibly challenging. Our family colleagues are being overwhelmed every day. The shortage is felt by everyone across Niagara, but especially those that are unhoused.
Our modest first step was building on the work of a nurse practitioner who was working at Salvation Army Booth Center in St. Catharines. We built a small one-room clinic, and each of us staffed it a half day a week.
Even people that have a family doctor find it difficult to access care when they need it. And for our clients who are unhoused, it's even harder. Trying to access care for an appointment that's booked weeks out is highly challenging for these folks. They often miss appointments and then they become derostered by their family physicians and then fall through the cracks in the healthcare system. These folks present to hospital in much more dire situations with issues that could have been prevented with better access to the primary care in the first place.
We grew fairly slowly at first. We got more support than we anticipated for this project, and the more we grew, the more need we saw.
REACH honestly bridges the gap. It helps to stabilize people in multi-facets of their life, and we do that with the help of our agencies that collaborate together to provide truly wraparound care.
Then COVID hit. We had to pivot to virtual care in our existing clinics, but that allowed us virtually to add 7 or 8 additional locations around the region. From there, the donation of the mobile clinic really increased our capacity to provide in-person care anywhere in the region, wherever people needed it, and by the end of 2024, we served 22 locations. At that first meeting over coffee, Fran and I would have never predicted the size that REACH has achieved at this point.
Carl and I worked in the same healthcare circles for a long time in Niagara. As I watched him build this incredible organization, I just knew that I wanted to be part of it.
It's the people that set us apart, the patient-focused care, the team-based nature of it, and it's very inspiring to see physicians reaching out to us to see how they can help.
I first started working with REACH by filling in for some of the physicians who are away at the different clinics, so I got to see multiple locations, and I also got to work with the team. The team is incredible, and I was sold.
I'm proud of what we've done and what we've achieved, and even more excited about our future. After speaking with Carolyn, our executive director, and with some soul searching, I've realized that I've contributed all I can, and it was time for a change in leadership.
Carl actually sent an email asking for any interest to step into his role. It really did speak to my heart, and so I responded.
I couldn't have been more thrilled.
I feel like I have come in after the big growth of REACH, but I see it growing even more as I see our vulnerable population in the Niagara region increasing every day, and we see that in the statistics. And so I really just hope that moving forward that we can continue to bring this care to all of those folks, to empower them and to lift them up in their lives.
My vision for REACH is that it continues to grow and that we're able to create more programs tailored to the needs of the people that we're serving. One of the big impediments is we're funded by grants and temporary funds. And to really provide good health care to the people that need it most, we need stable long-term funding. Really, for the first time, we're offering the opportunity for preventing problems with this population that are homeless, who end up with very bad health outcomes. And so now I'm looking forward to a future where we'll have more ability to provide preventive care to reduce hospitalizations, reduce illnesses, and improve outcomes for our people.
And truly, as our programs are building, they really are reaching out to people in so many different communities to make it much more accessible.
So my time working with REACH, I've just felt incredibly honored that people take me into their trust, that they share things with me that sometimes they've never told anyone before. And at the heart of it, I've learned that people are people. And except for a few circumstances, these people that I'm serving at REACH, they could be me, they could be you, they could be anybody. And so like I felt just a sense of gratitude that people would put their trust in me as their physician.
Yeah, I've seen that as well. And the other part that really impacts me is the team that surrounds us at REACH and the people that they impact every day. And I hear back from those folks that I work with on a day-to-day basis about what they're doing and what they're experiencing, and it's quite amazing. So my vision for REACH is really to help people find stability again in their lives. I really want them to feel empowered and lifted up by the community that's supporting them. I think the core of what we do is really to try to overcome those barriers that prevent people from accessing health care. And it really is about treating people how they deserve to be treated.
It's about fairness, so that everybody gets the same access to care, right?
My hope for REACH is that we can continue to provide care for everyone who needs care in Niagara.